I want to make a few comments about the current coronavirus pandemic and the issue of the shutdown versus another strategy which was pursued by Sweden, and to kind of see how the results compare, which is very interesting. Sweden is a country of about 10 million people. The United States is a country of around 325 million. So there's a vast difference in population and size. And it's kind of interesting to look at the numbers that you would come up with. If we look at our current situation in the United States, we're at about 4.7 million cases so far, or I should say positive tests. I'm a little bit up in the air as to, it definitely means people tested positive. It doesn't mean they were necessarily sick. Sweden is quoting around 80,000 cases. And again, the testing methods in the two countries may differ a little bit in the sense that I think, if anything, we are testing more intensively now, and particularly in the last month or so. So, I mean, for instance, I know of people that have gone in for medical checkups of sorts and had to be tested for it before they could go in and things of that sort. So that is going on here. I'm not sure how it is in Sweden. But if you look at the death rate, the United States is right around, 155,000 fatalities to date attributed to the COVID-19. And Sweden is just a little bit under 5,800 right now. So percentage-wise, their actual percent of population fatality rate is a little higher at about 0.57%, where the United States is a little bit lower at this point at 0.47%. So, however, if we were to apply their fatality rate to our population, and if we'd assume that if we'd have done the herd immunity approach like they did, right now we would have a higher fatality rate, around 185,000 deaths, or about 30,000 more than we already have had. And that, on the other hand, the damage to the Swedish economy has been relatively minor. I think 2 or 3% reduction in GDP or something. In other words, their economy, although it is recessionary because of still the global impact of the pandemic, has not been nearly as damaged or have the massive unemployment that we have, or the current national debt that we're encountering and trying to deal with it and to help people out because of the impact of the government policies, both federal and state. So I think it's an interesting thing to consider if we'd have. And the other thing that's kind of interesting is that their ongoing case rate and fatality rate have slowed to a crawl, looking like they may have achieved the goal of kind of where you want to be when you can reopen and do and so forth. Except of course they never closed down completely. So that's an interesting issue to consider. Should we have gone the other way? The fact of the matter is that the United States still compares fairly favorably to many of the EU countries, such as Britain and France and Spain and Italy, in terms of the damage that it's done. I think Germany is a little better than we are at this point, but not a lot. So, and almost all these countries have tried the lockdown social distancing approach. So it's just kind of interesting to note the difference. I'm not saying it would be better. There may be demographic differences in the United States that just makes a comparison unequal. I mean, for instance, the last time I looked at some CDC numbers, which are a little bit old, but I suspect that they're as true now as they were then, is that 53% of the U.S. fatalities have occurred among the African American and Latino populations in the United States. And since, although there is a fair amount of Islamic immigration into Sweden, I think it's not nearly as extensive. And so, point being that is a disproportionate hit on our society. We've also had a lot of deaths due to certain policies in states like New Jersey and New York and Massachusetts putting COVID-infected people into nursing homes. And of course, our nursing home fatalities are among the highest percentages of all of the fatalities we've had. So, and I don't know if they did anything similar to that or not. I tend to think not, or they'd had a higher number. So there are things we could have done without the shutdown that would have um, would have mitigated the number somewhat. And so with the policies that many of our state governors have pursued, we would have probably had a higher death rate than 180,000, 85,000, excuse me. And it could well be well into the 200s or so forth, um, you know, if that had been pursued. And we don't know for sure whether or not Sweden is really out of the woods, so to speak, because if you look at what's going on in Japan and Australia, which seem to have things extremely well under control not too long ago, we're now seeing their numbers moving up pretty rapidly. While, again, of course, the total numbers are fairly small as percent of their populations, but they're not nearly as good a shape as they were in just a month or two ago. So this is a really nasty, tricky disease, and it's hard to say. I'm not in a position of throwing stones at anybody. I think that a lot of the advice given is pretty good. Social distancing, of course, works if it's effectively carried out. The washing of hands or hand sanitizer is very recommended, and I think that helps a lot when you've touched something that somebody else has touched, like doorknobs and things of that sort. And masks, I think, in indoor environments are probably can't hurt, particularly if they're N95 or medical grade masks. The problem with masks is all masks are not created equal, and if you're looking to protect yourself, you need a higher quality mask, and even then, there's a lot of controversy. I just saw a study that was done that suggests that they're not that effective. Although, again, what I'm saying that the N95 level masks are much more effective than something made out of a T-shirt or something. So. Or a bandana or whatever. So, you know, use your own judgment on that. I do tend to wear a mask when I go into stores and stuff, but that's also currently where I live, the official government policy, so, and the store policy. So rather than trying to get in conflicts with people over it, it's easier just to do it, and it may help. Anyway, that kind of gives my summary of this. And we hope this gets over soon. One last thing I'd like to mention is I've heard the other day, I think a day or two ago, that Russia claims that they've developed a vaccine and are going to start giving out their healthcare people, I believe, on the 12th of August, which is kind of fascinating that they may be the first country to be doing mass inoculations of a vaccine. Now, the fact of the matter is that there are companies in the United States that currently have a vaccine, but it's in the one I'm thinking of, Moderna, I think it is in phase 3 testing with a plan of 30,000 people. Well, that's going to take a while to complete and tabulate the results and get FDA approval. So, I mean, obviously that vaccine could be given to the public without that testing, but you would be taking legal and political risks and health risks potentially if there is something wrong with the vaccine. If something was missed in phase 2 that would be a contraindication, or that if it really wouldn't be that effective. So I'm not recommending or complaining about anybody not doing it, but I'm questioning, is that what Russia's doing, that they've developed a vaccine and they're simply going to rush it into use rather than testing it up to the standards that we would do here in the United States? And that very well could be the case. At any rate, I just want to kind of address some of these issues around the pandemic. I think that we're still going to have trouble with this for a while till we get an effective vaccine. But I thought those are just sort of interesting issues to see how Sweden is doing. It seems to be an impressive result, but it may be unique to their culture. There could be genetic differences in the populations too that would leave one having groups that are more susceptible than the other does. So, at any rate, I'll end this for now, and like and subscribe if you appreciate these videos, and as everybody says, and that'll be it for now.